Hello and welcome to SheTech. We're so excited to be here representing Health Catalyst and so excited to support so many wonderful young women in their dreams in tech. I'm Crystal Anderson and I work for Health Catalyst as a people operations business partner, trying to make it a great place to work. And I'm really excited to introduce our panel of wonderful experts who work across Health Catalyst. So Health Catalyst is a healthcare data analytics company. We work with hospitals and health systems to harness data in order to increase quality, lower cost, and improve outcomes of care for patients across the United States. So I want to introduce our panelists. We have Jackie Howard, who is a senior software engineer working on our Leading Wisely product, which is a data visualization tool that we use to analyze our data. We also have Gail Benazio, who is a senior analytics engineer working directly with our hospitals and health systems. And then we have Jessica Curran, who is a data scientist who also works to develop models and techniques that we can use to better improve outcomes and harness that data. So with that, we are going to just lead a panel discussion about what it means to work in data and what these careers might look like. So we'll start with just a broad question. What does your day-to-day job look like? And we'll start with you, Jackie, if you want to just share what it's like to be a senior software engineer.
Okay. Yeah, I work on the, excuse me, the Leading Wisely project, which is our data visualization product that users, clients use to display the data in charts and graphs. And my job is mainly to produce the code that builds the charts and graphs. And I find that really interesting. Though my day is spent mostly typing away at my keyboard, I do have some exciting times when I meet with other team members to figure out how to solve some knotty coding problem or fix a bug or help a client figure out something that they need to do.
That's awesome. For somebody who loves coding, that sounds like a great job. Gail, tell us about being an analytics engineer and what that's like.
Yeah, so I have the privilege to work mostly from home, and I love the flexibility of that, especially since I have a family to take care of. So I wake up, I answer emails, and then I'll drop my kids at school. Then I'll come back, and I probably spend about half my day coding, and then the other half I'm designing charts and graphs. I have web calls with team members and with clients, so some interaction there. There's a lot of problem solving and creativity involved in coding, and it isn't just a bunch of typing all day long in a dark room. Sometimes I get to travel to different states to visit clients that I help, and it can be fun to be able to go to new places and see new things.
Awesome. I wish I got to travel more often. That sounds like a fun role to have. Jessica, tell us about being a data scientist and what that's like.
Sure. My job is probably pretty similar to Jackie's and Gail's, but I spend a little bit less time coding. So less time on math and coding than you would think for a data scientist. But one of the challenges in data science, not just in healthcare, but across the board, is learning how to ask the right questions and learning ways that you might be able to use your data to answer those questions and look for ways to improve. So I would say I spend a little bit of time on math and coding and a lot of time interpreting the output and the results. So working with our clients to ask good questions, to find the right problems to solve, and then understanding how their data might help them do that.
That's awesome. Can you share a more specific example of what type of work you're working on every day?
So one of the projects that I have been working on is using data to target inequity. So how can we use healthcare data to bring more equity to healthcare in general? So a quick definition of what that might mean and what that might look like. You may have seen a picture similar to this in the past. On the left-hand side, we have equality, and on the right, we have equity, which are clearly not exactly the same thing. Equality means that everybody gets the same thing, so our resources are spread evenly. And you can see from this picture that that doesn't necessarily mean that everyone has the same outcome. Equity, on the other hand, means that our resources are distributed in a way to help everybody get what they need for their unique situation. And the goal of equity is to give everyone an equal opportunity to have the same outcome. In healthcare, that outcome is health. And so the question that we ask is, how can we use data, how can we use measures to get closer to equity and give everybody the same opportunity for good health? So some definitions that will help us define equity in healthcare. First, we have a really broad definition, which is from the Robert Wood Johnson Foundation, which says that health equity means that everybody has a fair and just opportunity to be as healthy as possible. And so that might mean that you need to remove obstacles. That's where we're not necessarily giving everybody the same thing. The second definition centers around healthcare quality, and it's from the Agency for Healthcare Research and Quality, and says that quality in healthcare doesn't vary by personal characteristics like gender, ethnicity, geography, and socioeconomic status. The second definition is where we can focus our resources and our data. It gives us a framework to try to target interventions that will help in areas where we identify inequity. So one of the ways that we might do that is take a bunch of quality measures. These are measures that all of our healthcare providers and all of our healthcare organizations are reporting on already. Some examples are diabetes control, hypertension control, colorectal cancer screening, and others. If we take those measures and we rank them based on the level of inequity, based on data that we've collected, especially around our socioeconomic factors like geography, race, and age, we can find the areas where we see the greatest levels of inequity, and we can drill down a little bit. So here, for example, we're looking at diabetes control across different ethnicities and different age groups. Just looking at the measure a little bit more closely, instead of looking at the overall performance, but looking at our different groups, we can start to see trends. So for example, age is on our x-axis here, and we can see that across all of our groups, there's less diabetes control in the younger age groups and more in the older age groups. So when you think about this problem before looking at the data, you might have some preconceived notions that younger people are better at diabetes control. And the data, in fact, might tell you something totally different, like in this case. You can also see that age doesn't have the same impact across all of our ethnicities. So, for example, non-Hispanic whites have better diabetes control at all ages, and African Americans seem to have less diabetes control at all ages, and especially in the young population. So once we start to identify these areas, and especially start to identify the populations that might be at risk for lower performance, we can start to look for solutions. Some solutions might be to target those groups that are performing poorly. So we might be able to use culturally tailored educational materials in a patient's native language. We might be able to send out test kits for people to use at home, so that could help people that have less access to care. And then, of course, we can continue this exercise over time. We can use data and analytics to measure the impact of those interventions over time to try to understand whether we're actually improving, whether we're doing better, and whether we're reducing inequity over time.
That's awesome. I think all of us here, and probably many of the girls who are listening, care deeply about making sure that people are treated equitably and fairly across populations, regardless of race, ethnicity, gender, location. So it's really cool to be able to work on those on a day-to-day basis to literally make an impact for those people who may need better access to healthcare. So thanks for sharing that example, Jessica. That's awesome. I'd love to talk more about the day-to-day aspects of your work, because I think that's really important for these girls as they're trying to think about future decisions, as they think about their career, as they think about going to college. Gail, I would love to hear if you can speak to kind of what are the hard parts of about your job that make it difficult sometimes.
Yeah. So every job has positive and negatives. One thing I find to be a negative is it's an office job. So I'm sitting all day long, and that's a real downside. It took me a while to learn to add in break times where I get up, I walk around a little, go to the kitchen, get a drink, something like that, just to break up the day. Also, being on a computer all day, it's easy to become distracted by the emails and texts and social media that pops up. It's nice to have a job where you are allowed to check your texts and your whole life doesn't have to stop for 8 hours a day where you work. I've had jobs where it was like that. So it's really nice that I can do that and just learning to manage.
That's awesome. Thank you for sharing. On the other end of the spectrum, I'd love to hear from you, Jackie. It's so great to hear how enthusiastic you are about being a software engineer. What is your favorite part about your role?
Oh, there's lots of favorite parts. I know it doesn't sound like it's an exciting job, but I find it really is. I love problem solving, I always have. And I started learning programming at high school myself, but that was a very long time ago and a very different time. But yeah, I love the process of making a program, which can be frustrating when you just can't seem to quite get it right. But then you get that aha moment and do a little happy dance when you finally got something working. It's great to see users using something that you've created, and they hopefully enjoy using it and makes their life easier and more effective. I love that there's always something new to learn. I also get to learn about all sorts of other things, because you don't just code in a vacuum, you have to be doing it for someone. So I'm learning an awful lot about health and healthcare and the struggles that hospitals and patients have, and it's really exciting to be part of hopefully making their outcomes better, and also it's always good to be in a job where you can make a bit of a difference and help save lives. So I love my job.
Awesome. Jessica, I'd love to hear from you. How did you get interested in your role? How did you end up as a data scientist?
Sure. Well, I always liked science, and I always liked math. I always loved problem solving and logic puzzles, anything, any games really in that area. I didn't really have any ideas of how I could use that in a career. When I went to college, I majored in science, and then when it came time to get a job, I was lucky enough to get a job in healthcare software. And then on the job, I started to understand the parts that I liked and the parts that I didn't like, and also understand where there was a need to understand healthcare data a little bit better and use it to solve problems. And so that led me back to school, where I got a degree in statistics, and led me eventually to Health Catalyst.
And I think that's a great segue into our last question, which is, for girls who are watching who find healthcare data interesting, or software engineering, or just data analytics in general, what are the things that you would recommend that they can do now to get involved and to start on that path as they prep for college and for future careers? Jackie, maybe we'll start with you.
Okay. Well, just if you're good at problem solving and you like things like Sudoku puzzles and logic puzzles and any kind of puzzles, then you can train yourself doing those to think in a logical way. So that's the first step, I would say. Then there's a million online resources, and a few that I would recommend. One is Snap, which is a graphical coding language where you grab shapes and build a program that way. That's a really good start. And Snap is a slightly more grown-up version of Scratch, which younger kids can use. Then the next stage would be maybe Code Academy, where you learn it's like real programming with the languages that we use instead of the graphical interface. And yeah, at school, if there's a group of you who are really interested in getting together, you can set up a Girls Who Code club at school. And then we have links to all those things in the notes that we're going to send to you.
Great, thanks, Jackie. That's so many good resources. How about you, Jessica? If girls want to get involved in data science, where should they start?
So I think Jackie already gave some really good ideas and resources, and those would also apply to data science. If you're specifically interested in statistics or in machine learning, you might also check out Khan Academy or Data Camp. If you want a broader view of what data science is and how it's used across industries, or even specifically in healthcare, you could do a quick Google search, and you will get a whole range of articles telling you how these things are being used in all industries. And then you could look more specifically at healthcare. If you are interested in going to college and you want to pursue data science, and specifically data science in healthcare, you might think about studying statistics or data science or biostatistics or epidemiology. All of those would be a path toward data science in healthcare.
Wonderful. And then Gail, anything you would add that girls should be working on now?
Yeah, I'd echo a lot of what's been said. If you're interested in the healthcare side, so like I do healthcare data, then learning Latin roots is very, very helpful. That's going to also help you on the ACT or your college entrance exams. Latin roots are really big there, but it helps me in my day-to-day job just understanding medical terminology. You don't have to learn each word, you can decipher them. And then touch typing, I would really recommend learning to be able to type without having to look at the keys. It saves me so much time. And that's not just for coding, it's really for any job. You do a lot of typing nowadays in all jobs, and learning to type by sight and typing quicker speeds up your workday and takes off some of that brain power because you're just automatically doing it. It's not something else to think about. So I highly recommend that.
Thank you. Those are really good practical, real world skills that do apply for so many different fields. So thank you all, Jackie, Jessica, Gail, so much for being here. We're really excited that we could participate even in this little way in SheTech and support all of you in pursuing your dreams in tech. If you have questions, please don't hesitate to reach out to us or to the conference coordinators. I'm sure they can connect you with Health Catalyst, and we're happy to help answer your questions further. But best of luck to you, and thank you so much for being here today.